Hi there, my name is Matt. I'm a respiratory therapist at Royal Inland Hospital here in Kamloops, and today I'm going to be talking about the Optiflow. So what is Optiflow? Optiflow is a high-flow oxygen delivery system that heats and humidifies the gas to body temperature and delivers it to the patient through either a nasal prong or a trach interface. One of the first questions I get about it typically is, what are we replacing with the Optiflow? Really, here at Royal Inland Hospital, we're not replacing anything. If you think about the oxygen therapy that we provide our patients now, starting at nasal prongs, going to a simple mask, then a high-flow aerosol device, the really next thing that we can provide our patient, if they need more, is BiPAP. So this Optiflow is going to fit in that gap between BiPAP and high-flow aerosol therapy that we give now. What can it do? So it's designed for patients greater than 22 kilos in weight. It can deliver 30 to 100% oxygen and deliver flows anywhere between 10 and 60 liters a minute. So again, another question that comes up, why would we give such high flows through nasal prongs? The big thing when we're thinking about escalating up the oxygen therapy levels is, as we move towards that high flow aerosol device, we're trying to give the patient high concentrations of FiO2. The problem is that we're not meeting their inspiratory flow demands. So what's happening is the oxygen that we're delivering to them is being diluted by the room air that they suck in, that they need to meet their inspiratory demand. So the Optiflow will actually give enough flow of 100% oxygen, if it's what we need, whatever it is that we need, to meet the inspiratory demand, so it's not being diluted by the room air. So we can actually give a patient a true 100% oxygen, as opposed to we top out typically around 80% on our previous oxygen therapy devices. The next question then, obviously, if you're using 60 liters a minute, is it comfortable for the patient? It actually is, for two reasons. One, the gas is heated and humidified, as opposed to the gas that we deliver out of the wall of the hospital. The oxygen that comes out of the wall is typically about 18 degrees and bone dry, no moisture in it whatsoever. So it can be quite uncomfortable at higher flow rates to the patient. So if we heat it to body temperature, 37 degrees, and 100% humidify it, then it's more comfortable for the patient. So you don't really notice as much. The other big difference, and I'm going to go through the components of the Optiflow later, but is the nasal prongs themselves. They're much wider and much softer. So because you've got that wider channel for gas to flow through, it doesn't get that jet effect. So it's much more comfortable for the patient. What are the benefits of heating and humidifying other than patient comfort? Is the moistening of secretions. If you moisten those secretions, you improve their mobility, the ciliary clearance improves, and improves the patient cough. A lot of times we have a good example is an pneumonia patient. They have a lot of secretions. If they're deteriorating, we'll put them on BiPAP to try to avoid intubation. The problem with that is we're strapping a mask on so they can't expectorate their secretions, and on top of that we're drying those secretions out. So something like the Optiflow would be a much better choice. It's only in the nasal prongs, they can still cough up their secretions, and with that heat and humidity it will help the ciliary work well and it'll moisten those secretions so that they can cough them out. So that's a big benefit. The other thing with those high flows, not only meeting the inspiratory demands of the patient, but we're also helping them facilitate bigger breaths. So as their breaths get bigger, the respiratory rate will come down and their work of breathing will come down. It makes it easier for them to breathe. So a lot of times you'll see a patient who's tachypnic and you'll put them on the Optiflow and they start to settle relatively quickly. Their rate will come down, their breath just seems easy. It seems to facilitate a slower breathing pattern. The other thing to think about is when we exhale normally from our alveoli in the lungs, when we stop exhalation just before breathing in again, there's CO2 in our mouths, our upper airways, our large airways, all the way down to those alveoli. So the first bit of our first breath in normally is a high CO2 content. With Optiflow, because of those high flows, it actually washes the CO2 out of those, that's called anatomical dead space. So it washes the CO2 out, replaces it with oxygen, so their next breath has less CO2 than it typically would and higher levels of oxygen. With those high flows, there is a small bit of dynamic intrinsic pressure. We don't like to refer to it as PEEP or CPAP, but it's similar to that, where there's a little bit of pressure built up internally in the lungs. So you can get the benefits of a low-level CPAP as well, but again, not the intention of the device. I'll go over it later with the prong fitting, but this is not a closed system. The idea is that it's open and the gases are flowing, so not CPAP. The last benefit, and it's a big one for me, is infection control related. So typically our high flow oxygen aerosol delivery systems create an aerosol in the name. So what happens is that's a big enough water particulate to carry infection. So if you have someone of an unknown etiology, pneumonia, or on droplet precautions, you put them on a high flow oxygen aerosol setup because of their increasing oxygen requirements, then what you end up doing is aerosolizing that infection in the whole room. You pretty much have a 10-foot radius of a cloud of infectious particulate in the air, like walking into a giant sneeze all the time. It puts other staff at risk and other patients at risk as well, especially if they don't think about it right away and maybe are walking in and out of the room without proper airborne precautions like an N95 mask. The Optiflow only creates a vapor. The vapor is way too small to carry anything, even the smallest bacteria, so there's no risk associated with the staff or other people coming into the room. So that for me is a big benefit, specifically in emerge and unknown etiology of the respiratory infections and such. So let's go over the components of the Optiflow now. It's actually a pretty simple device. You have the stand, it's pretty much a pole. On the pole, we've got this little unit right here. It is comprised of just a flow meter and then an oxygen analyzer. There's gas coming in from the wall through a hose into the back of the flow meter. You can adjust your flow with these dials and the oxygen that you'd like with these dials, and you'll see the reading up here. So the nice thing about the Optiflow is you can adjust the flow of gas to the patient and the percentage of oxygen in that gas separate from each other. So if you wanted to increase the flow to try to improve their volume in their breaths or wash out their CO2 more, then you can do that and keep the oxygen concentration the same. Or if you're happy with your flow but you felt like their sats are maybe a little bit low and you wanted to give them some more oxygen, you could do that independently of the flow. Kind of a nice thing about it. The only real button to push is this one, which turns it on, and you'll get your oxygen percentage reading right here on this screen. This is your oxygen analyzer. So let's move this right here out of the way. This is the oxygen analyzer here. The only thing for nursing to know with this is if this falls out, there's a big hole there. It needs to be just pushed back in, and it's just friction fit into there. Once you set the flow and the appropriate oxygen concentration with your dials, the flow is sent through this big tubing down to our heater. And again, this is a basic heater. You have your on-off, which you just push the button and it fires up. The big one for you guys is a silence button. I know that's usually the first question. And then this is just a button to adjust temperature. Respiratory will take care of that for you. So I'll just turn it off for this demonstration. So once the gas is heated and humidified to the appropriate temperature, it'll go out this other hose up towards the patient, and then there's another temperature probe at the end of the hose, just to make sure that the temperature of the gas is consistent to the patient. This is also got a wire in there, so it really gets rid of that condensation that tends to build up in our high flow aerosol setups. You guys probably always have heard that wishing water back and forth and you have to drain it and that kind of thing. With this circuit, that shouldn't build up. If it does though, just tilt it up and the water will go back into the chamber, so that's fine. So next we have the patient interface after the circuit here. It comes in a package that looks like this with the size on the back. They come in small, medium, and large, the nasal prongs. And it's all clear, so you can have a look at it. What you're shooting for when sizing it for the patient is you don't want to have the nair more than 50 to 70% occluded. So you don't want it sealing perfectly in there because then you're creating a CPAP type system. What you'd like is a free-flowing, high-flow oxygen setup with gas being able to flow around. So half of the nair, roughly, is what you'd look for. So you can just sort of eyeball it with your patient. So let's get the prongs themselves out. When you take it out of the package, you've got one end with the prongs and the other end just has a little circle connector. That just friction fits onto the end of the hose and then you've got a good connection. Then the prongs themselves come with two lanyards. Okay, the first one goes around your patient's neck like so. And then the prongs themselves, I don't know if you can see them from there, but they're very, very soft and malleable. And this is all soft too, so you don't really get any big pressure on the nose themselves. This part ideally should be resting on against their upper lip, and the prong should be in the middle of their nose. And you would take this second piece over their head as you would with regular nasal prongs and put them in their nose, and then just tighten up the side straps to get to stay where you want it. Now you can kind of see right now I've got some tugging on here. What you want to do is grab this lanyard and pull it nice and tight. What you're looking for is a letter C. So now I can turn my head and I've got room to do that. You don't have weight pulling on the prongs themselves. There shouldn't be weight pulling on it. If that doesn't happen, then you get this kind of thing where it's pulling on them and you get a potential for a sore there. So try to remember the letter C and tighten it up there so you can kind of see what's happening there. So another option with Optiflow, other than the nasal prong interface, is the trach adapter for our trach patients. It has the same circle connector for the circuit itself. It only comes with one lanyard. I don't know if you noticed with the other lanyard for the nasal prongs, but it was a breakaway lanyard so that patients wouldn't unintentionally hang themselves or choke themselves. With the trach one though, it's not breakaway, with the thought being that if it did get pulled on, because it's attached directly to the trach, there's potential there for dislodging the trach. So this was actually one thing to be aware of. We have our trach patient here. He's got our basic trach setup that we use in the hospital with our aerosol tubing and our trach mask. You can see the trach mask just sort of sits on his skin around the trach and provides some humidity through the setup. So if we take this off and wanted to put our patient on Optiflow, you would take the lanyard that we have here, place it around the patient's neck so when they get up and move around, it's sort of there with them. And then the interface actually connects right onto the trach itself. So there's no pressure or anywhere for anything to rub on their skin. This is a little sputum shield, so you can have that protect yourself when you're in the room. It just pops right off if you needed to clean it or if you needed better access, and again pops right back on. Yeah, so it's kind of an ideal thing for our trach patients because we're bypassing their upper airway, which would normally heat and humidify their inspired gas. So because we've taken that away, this is a great thing for them. They just tend to love it, and it really does work well with their secretions as well. Okay, so that covers most of what the Optiflow is. I think once you see it in action the first time, you're going to see what it can do and go from there. I find most patients that use it they say that it kind of feels like they're at the spa and they like it. It's warm, it feels good, and you're going to have a hard time taking it away from them typically as they get better. As far as the setup and what flow settings and all that stuff, respiratory will be responsible for that here. So if you have a patient that will need Optiflow, respiratory will come and initiate it. We'll titrate it, wean them if needed to be, and then we'll discontinue it for you. So there's not a lot to worry about there. The one thing I would like to mention though, I mentioned the flow meter and the oxygen analyzer earlier. Once they're a little bit finicky to set up with these two dials, they use something called a Venturi principle. So as you adjust one, the other one is affected. So once it's set up and the RT and everyone's happy with it, if the patient needs to get up and say go for see physio and do a walk, or needs to go to the bathroom, or needs to go to CT, this is not available for transport. It's only at the bedside. So what you'll have to do is call the RT up to help get you ready for transport. You'll probably send the patient on an on-rebreathe to wherever they need to go. The other thing to keep in mind though, and instead of turning these dials down, as I mentioned, they're a little bit tricky to kind of set up, there's a switch on the back, a little blue switch, and you would just switch it one way to turn it on, and you can hear that's what it kind of sounds like when it's running. It's noisy, but not as noisy as our aerosol setup. And then you switch it back and it just cuts the flow to the machine. So everything goes quiet and is turned off. When you come back, you just switch it back on and it goes back to its previous settings. So it's very easy and simple to do. Otherwise, for nursing, as far as the responsibilities when they have an Optiflow patient, the biggest one that we can't stress enough is the respiratory assessment. So what tends to happen with these patients is they don't look so great, and you call for support, respiratory comes, we end up putting the Optiflow on the patient, and the Optiflow starts to work well, which is what we want it to see. Their rates come down, their work of breathing gets better, their SATs increase, and overall they just look better. But the thing to remember is that this patient is still very sick. If we pulled the Optiflow off of them, they would deteriorate potentially back to that same point they were before initiating it. So remember that even though they look better, they look comfortable, they're talking, they're eating, they're still very sick. So keep doing those very detailed respiratory assessments. The other thing is if you have any questions about it, so you've done an assessment and you're not sure, please page respiratory. We will come up and back you up and have a look at the patient and let you know what our perspective of things is. So please do that. The other thing is if you're getting it set up for the first time on your floor and you haven't had one before, you're not 100% comfortable with it, again, when respiratory is at the bedside, please ask them for a quick in-service on what is Optiflow again, and maybe grab some of the other nurses on to, again, it's part of the service provided by respiratory is going over these kinds of things, and you may not see it very often, so we'll have to see. The last thing is the water bag. So this is, and I didn't really go over it earlier, but this is what comes down to the heating chamber and gets heated to provide the humidity. This will drain off, it depends on the flow that you have set up, the duration of how long the bag will last, but typically a bag a shift is probably our average. As it depletes, it will need to be changed. Please don't let it run dry. If it is getting close to empty, you can either change it yourselves. It's a sterile water bag, which respiratory will bring up and put at the patient's bedside, and you just spike it as in any IV bag. Or you can page respiratory and we'll come up and do it for you. Right now we've got a 1 liter bag hanging. For those units that purchase their own Optiflow, it's likely that you'll see a 2 liter bag that's specifically for Optiflow. So it's quite a different looking bag, much bigger. But other than that, I think that's everything I have to tell you about Optiflow. So yeah, I hope it works well with you. I hope you get to see it and are happy with it. And again, if you have questions, page respiratory. Thanks.